Good morning, everyone. Conferences, I'm told, are like children. There are moments of agonizing frustration that make you want to pull your hair out, if you should have any. And yet there are moments of intense pride. But from a global health and epidemiology perspective, there's another uncanny similarity, which is that conferences and children have a remarkably high under 5 mortality, which gives me particular pleasure in welcoming you to the 5th annual Global Health Economics Colloquium. For those of you who've been with us the whole way, you know we started out as a platform supported by the Philip R. Lee Institute for Health Policy Studies and the Institute for Global Health Sciences here at UCSF to exchange ideas among faculty and trainees interested in global health. Very quickly, we expanded with the support of Stanford Center for Health Policy and Primary Care and Outcomes Research under my mentor and guru and now fashion role model, Doug Owens, and at the School of Public Health at Berkeley with Will Dell and Steph Bertozzi. This year, we are pleased to announce 2 more partners. We have the support of UCSF Center for Vulnerable Populations at the Zuckerberg San Francisco General Hospital, and our first out-of-state partner, the University of Washington, under Karen Levin and Judy Wasserheit. It's these supporters who allow us to continue to thrive, have done so for the past 5 years, and allow us to craft an ambitious agenda for every event. So thank you very much. Our theme this year is the economics of health in vulnerable populations at home and abroad. Jim and I would take credit for this timely theme had it not been for the fact that it practically wrote itself. We wake up with every news cycle acutely aware of the breathtaking pace of change around us. In the last 10 years, we've changed how we communicate with friends and family, how we shop, how we consume news, how we travel. And not all change is good, but the change is real. This iPhone is just 10 years old, and it's gone from being a phone to a way to exchange ideas and insults with strangers halfway across the world. With this awareness of change is this idea that we live in a profoundly unequal world. You've heard of the Oxfam statistic that now 42 people own as much wealth as 50% of the world's population. The top 1% owns more than the bottom 99%. And here's something that gives me pause, which is that a CEO of a top 5 garment company makes more in 4 days than a Bangladeshi garment worker will make in her lifetime. Vulnerability, of course, is more than just poverty and income. We have, it can come from many different flavors: race, ethnicity, sexual and gender orientation, incarceration history, housing status, language proficiency, immigration status. Heck, some days I, as an academic professor in a leading university with this crazy geopolitical situation, feel like I'm vulnerable. So we set out the question, what defines vulnerability today? Who's vulnerable, who's not? How do we measure vulnerability? And how do we design and measure and evaluate innovative interventions to improve population health? That's the mandate for today. And we have an exciting lineup of speakers for you, and we hope for very thought-provoking conversations. But here's a quick rundown of the agenda. We'll start with a discussion of food insecurity in the US and overseas. Our first keynote, Dr. Bivens Domingo, is, as you know, the UCSF Vice Dean for Population Health and Health Equity. We set her the very easy mandate of how she thinks about vulnerability, given that she's thought about vulnerability longer and harder than most of us here as a former director of the Center for Vulnerable Populations. We figured that her thoughts on this would be a perfect anchor for the conversations for the day. We'll follow that up with a quantitative panel on measuring vulnerability and impact of interventions to improve population health. With no irony at all, after dessert and lunch, we'll be talking about cardiovascular prevention and the economics of that. Followed by our second keynote, Dr. Ashish Jha is the director of the Global Health Institute at Harvard, also the senior associate dean at HSBH. And he serves in the National Academy of Medicine panel on universal health coverage, which you know is the mantra of our times. It's the way to make everything better, right? He is going to take the provocative position that maybe that's not the case, and that UHC, unless we're thoughtful about it, could actually harm the world's poor. So I'm really looking forward to that talk. We'll have a panel, before actually Ashis's talk, we'll have a panel on how we can use best business practices in global health, whether that's how social media companies think about reaching their customers or how enterprise software companies think about increasing access to their software. Can we use those techniques to improve population health? We'll close with a panel that discusses whether, if your goal is to improve population health, we should develop targeted interventions versus universal interventions for population health. Please join us at the end of the day for a reception with wine and hors d'oeuvres. If the conversations are as engaging as we think they will be, we'll be ready for wine at the end of the day. Quick logistical stuff. We expect more people to show up, so as the day goes by, if the room fills up, please move to the center of the aisle. We'd appreciate you switching off screens and phones unless you're tweeting, in which case the handle is #GeekOn2018. There's coffee and tea around the clock outside, and we hope the coffee is good because that's the purpose of life as far as I'm concerned. But I want to acknowledge all the people who made today possible. None of this, needless to say, would be possible without the tireless efforts of Devin McCabe, who's our project manager of the Consortium of Assessment for Preventive Economics. She provides both the institutional memory and the sheer hard work that goes into organizing an event this size, and she deals with Jim and me incessantly for several months. That alone is incredible. So thank you, Devin. Thank you very much. I want to thank Jay Sullivan, who's our videographer for the day, Cindy Chu, who is capturing moments on her camera. We have CVP staff, Mekla Hoskot and Kelly Kaiser. Thank you for your help. And we have interns this year. I want to list them. Angie Wong, Rachel Change, Liam Erickson, Sasha Dektar, and Jeff Azania. Thank you, thank you, thank you. I want to conclude this with this one final thought. For those of us who take care of vulnerable populations, these are strange times. Last year, the Colloquium was held right after the Women's March, and we chuckled at the idea of a post-truth world and worried about the concept of alternative facts. It's hard to say whether the year that's gone by has been better or worse than predicted. The Affordable Care Act still stands, though the individual mandate has been stripped. The tax reform means that there's a larger deficit, meaning safety net programs are likely to be on the chopping block soon. We have the fate of dreamers hanging by a thread. The CDC has been told not to use the words vulnerable and transgender in their budget. The economy is booming, but so is the threat of nuclear war. I will confess that some days it's hard to wake up and do research and write papers when it feels like the world around us, so to speak, is falling apart. Our hope for the day is that our speakers and conversations will remind us why we do what we do. Will remind us why it remains important for us to generate high-quality evidence, to support and advocate for evidence-based policies, and most of all, to inspire us at a time of this geopolitical craziness, why we must continue to persist. Thank you, everybody, and welcome to the 5th Annual Global Health Economics Colloquium.
Greetings. I am Jim Kahn, and I just want to add a few thank yous to that excellent introduction and overview of the day from Kazi. First of all, thank you to Kazi, whose idea that this be a full-day event, who had that idea, which has worked out brilliantly, and for his tireless effort to translate the notion of a conference on vulnerable populations into a reality. We had many fun conversations, and it's been great to pull this together. It's great to see all of you. I want to especially thank several institutions or units within UCSF. The Institute for Health Policy Studies is where I've made my home for a quarter of a century, and Claire Brindis, who couldn't join us today, has been endlessly supportive, both spiritually and financially, of this enterprise, and I really appreciate it. Global Health Sciences, where I've made my home for about 10 years. Jaime Sepulveda and Colin Boyle in particular, and the staff there as well, have been incredibly supportive and helpful for this event. They, among others, helped us get the word out. and have provided that same spiritual and financial support. We're just endlessly thankful, and also really, really thankful to our collaborating institutions who you will hear from momentarily. It's been really gratifying to maintain and expand our institutional base, to have more people involved in conceiving of and participating in the conference. So with that, I will turn it over to Doug Owens to offer a word from our partners down south. Thank you.
Thanks, Jim. On behalf of everyone in the Stanford Health Policy community, I want to welcome all of you. We're delighted to be here again. I want to, Kazi mentioned that I was a mentor of his. In a small way, that's true. I will take credit for teaching him everything he knows about hairstyles. And if you want to know the difference between the UCSF people and the Stanford people, the UCSF people are wearing ties, and I don't know why. That was a little shocking to me. At any rate, welcome. We're looking forward to the day. I want to thank Jim and Kazi and Devin, of course, and everyone up here at UCSF. They are the heart, soul, and brains behind this. We feel really honored and privileged to be able to join in this, and so I think it's going to be a spectacular day. Thanks to you all very much.
Thank you. I'm Will Dell from UC Berkeley, and I just want to add my thank you and welcome on behalf of the Berkeley School of Public Health Dean Steph Bertozzi, who could not be here today. I am especially grateful to Jim and Kazi and Devin and everyone who organized this, because we can certainly claim no credit for the organization, but we claim many benefits from the conversations and linkages that happen through this event every year. So I have heard many extremely gratifying stories of new collaborations and projects that have been facilitated by those one-on-one, in-person conversations that people actually have face-to-face, amazingly, during this meeting over the past several years. And so I look forward to hearing more of those stories. I'm at your disposal for making introductions to folks on the Berkeley side, to colleagues. So please feel free to come up and ask for such introductions. Again, thank you. We're looking forward to a wonderful day.
Let me add my thanks to the others. Judy Wasserheit, the chair of our department, graciously decided to support this, and I was pleased because I've been coming here since the beginning, I guess 2013, and kind of jealous of this wonderful connectivity of health economists, epidemiologists, social scientists, medical doctors, coming together to look at global health economics. So I was feeling kind of left out up there in Seattle. So now we're squarely part of Kahn. And I have to say, I've watched this consortium grow, the Colloquium grow over the years, and what we really value, especially at the Department of Global Health, is the interdisciplinary nature of this meeting. And we really appreciate hearing other perspectives and bringing health economics into the work that we do. So I'm looking forward to another great day. Thank you.